Hi, my name is Kimberly Watson. I was born in Pennsylvania, raised in Delaware, and moved to Jacksonville, Florida in 1984. And in 1996, I became a licensed practical nurse and continued on to study and became a registered nurse in 1998. This is when I entered the world of emergency room nursing. Since then, I have seen an overwhelming increase in volume of patients coming through the emergency room on a daily basis. It is believed that this increase is due to patients using the emergency room instead of their primary care physicians. Emergency rooms are now putting an emphasis on discharge planning to encourage patients to use their primary care physicians, and an extra emphasis on the primary care physician being part of well care on a regular basis. Most patients do not understand by establishing this relationship and utilizing a primary care physician, they will receive comprehensive care. That is to include the whole person: medical, physical, emotional, and mental well-being, as well as continuity of care, where the patient and the physician together cooperate or collaborate and involved in an ongoing healthcare management towards the goal of high-quality, cost-effective care. Several studies have been done that have proven that areas that have more primary care physicians per capita, the patients in that community are much healthier. They have a decrease of cancer, decrease of heart problems, as well as strokes. In a separate study, it also suggests that areas and communities with more primary care physicians, that the lifespan is longer. So increasing primary care physicians in the communities, there's fewer deaths, premature deaths. The use of primary care physicians should be only for non-urgent care. You always want to go to the emergency room or call 911 if you've got an emergency and or something urgent. Some of the benefits of using a primary care physician is you'll have an annual well visit set up to keep you healthy, as well as I said before, the continuity of care. And this type of relationship, your PCP may be able to recognize and treat medical conditions before they become a problem. This is the most effective approach for health care, unlike in the emergency room. It also allows for better follow-up care on an ongoing basis. There are a few disadvantages to using a primary care physician. Most of us are real busy these days, and you obviously have to make an appointment, so you can't procrastinate things. You've got to set your appointments, and you also got to hope that there's not a backlog of appointments. Sometimes that's a problem, where you make an appointment and you can't be seen for several months. Another problem that is seen with primary care physician use is when you go to the emergency room, they do a full comprehensive workup on you because they don't know you, and typically you get the test results before you are released that evening, if in fact you are released. So that would be a disadvantage, where in the PCP's office they usually send you out for tests, x-rays, blood work, that kind of thing, and normally you won't get the results until like a day or several weeks after. But certainly the disadvantages do not outweigh the benefits. You may be wondering how to find a primary care physician. As in any relationship, it's not easy, and it requires work. You may have to go through several primary care physicians before you find the one that works for you. A few questions that you may want to ask when you are looking for one is, are they accepting new patients? Do they accept your insurance? Do they utilize and have privileges in the hospital that you like to use? And how backlogged are they? Is it easy to get in for a scheduled appointment? These are just to name a few, and I do have some handouts here with some other prime questions when looking for a primary care physician that you may want to ask. In closing, I don't know if you all know that 82% of Americans had contact with healthcare professionals during the past year. And the Center of Disease Control and Prevention. With steps like these, the odds are that each and every one of you over the next 365 days will seek some kind of contact with a healthcare professional. So it could be a scheduled appointment at your primary care physician and or the use of the emergency room. So I believe it's time with statistics like this that you take control of the situation and get yourselves a primary care physician so you can better take care of your health. Thank you very much.